I'm Amaka, and I'm currently at the National Robotarium in Edinburgh.
It feels like science fiction, but at this centre they're testing real advances in AI and robotics that could shape the future of the NHS, putting humanoids into healthcare.
In hospitals or healthcare settings, I could assist with patient interaction, provide reminders for medication, and help streamline administrative tasks.
Ambitious options for helping patients could be within grasp.
These are the most advanced haptic gloves in the world. Haptics is basically the sensation of touch that you could get in either a virtual world or through, in this case, a robot. So you'll be feeling what the robot effectively is feeling from these gloves.
So these are robots with a human touch, basically.
Exactly.
The idea is that medics can feel their patients remotely with the help of these hands, cutting the risk of infection, carrying out jobs that could be too dangerous or too distant.
If I touch the robot here, for example, on the pinky, you should be able to feel that.
Oh, yeah.
And hopefully you can feel it moving around as well. There's, obviously a labour shortage in the NHS. The islands, I think, would benefit. So at the moment, if there's a medical emergency, it might take hours or more to actually access, skilled personnel, skilled nurses and clinicians. If you had a teleoperated robot like this, a skilled professional that's hard to find, they could just teleport in from Edinburgh.
So is this type of technology being used anywhere else in the world already?
So there are some semi-humanoid type robots being used in Texas. And I think Scotland, obviously we're a forerunner in the technology, so really we would like to start trialling in the NHS here.
Right now, the technology is being tested in a hospital in Helsinki, where nurses use it to try and carry out day-to-day tasks on the wards.
Scandinavia is very willing to take sort of almost the risk of trialling these technologies. And so if we can de-risk it there, then maybe the NHS will see it as a lower risk to then using it here as well.
Hello, I'm Ari, the friendly robot receptionist here to help you.
Ari answers routine and repeat questions without getting annoyed. She's been used in a Parisian hospital for dementia patients. Hi Ari, where are the toilets?
To find the toilet, please leave this room.
And programmed with a bit of personality. Ari, I'm feeling really anxious about my appointment today.
I'm sorry to hear that you're feeling sad and anxious about your appointment. Is there anything I can do to make your day better?
Can you tell me a joke?
Sure. Here's a joke for you. Why did the tomato turn red? Because it saw the salad dressing.
We worked together with the hospital staff on this because what they actually wanted was to spend their time doing useful things and not, for example, answering repetitive questions. So what we're trying to do is build supportive, collaborative systems that fit into a real work environment that can mean that the humans who are there can spend their time doing more interesting, more valuable tasks. And what we try to do is kind of take away the sort of drudgery, repetitive things.
The argument is that these developments will assist rather than replace human staff. But there are clear concerns about what risks a robot revolution could present.
We know that robots are very good at very predictable work, where nothing unusual happens. And the difficulty is that things that are unexpected are unexpected. So you can't program a computer for something that's unexpected. And whilst there are some situations where that doesn't matter, it's just inconvenient. In healthcare, that can be critical.
You certainly can't ignore the fact that it's a disruptive technology. Like a number of technologies in the past, there will be a change in our society as robotics comes in. But I think for healthcare, it needs to be looked at. The benefit to the NHS is not just about robots versus the cost of human staff. This is about the actual savings and the efficiencies that are introduced into the system. China has invested massively. And a number of countries around the world have now published their robotic strategies for their economies, and that's making a difference.
And we have no robotic strategy?
We have no robotic strategy.
What are the risks to the UK if we fall behind here?
It's going to have an impact both on the economy and society. So we could be a passive adopter, not producing it ourselves, just taking it on and using it. We certainly don't have the option to ignore it. But if we do that, then the benefits are going to be very limited.
And if some of this still feels scary, here's something a little softer. Cushions are moving.
The cushions are moving.
These pet-like cushions are being developed to comfort people in care settings and try and combat loneliness.
This can work because you have the expression of behavior, because you have like an emotional sound and you create a connection with it, an emotional connection. You can create that with a mecha, which is like a humanoid robot, but you can create this as well with a little pillow which moves and reacts to you.
Amazing. Oh. I think we've formed a bond already. No replacement, of course, for true human empathy, but it's not hard to imagine these wriggling around our homes in the future.